Hello, my name is Julian Barrett. I'm a clinical academic nurse practitioner. I've been working as a nurse practitioner for over the past 10 years in the United Kingdom in a variety of clinical settings. And I'd like to talk with you about the development and role of nurse practitioners in the UK. So first of all, I'd like to speak about how we define a nurse practitioner role. A nurse practitioner is a registered nurse who, in addition to their 3 years of general nurse training, has undertaken an advanced course of study at either undergraduate or postgraduate degree level, covering a wide range of advanced clinical topics such as pathophysiology, clinical examination, history taking, pharmacology and prescribing, diagnosis and clinical leadership. Nurse practitioners work in a variety of clinical settings in the UK and have taken on roles that traditionally would have only been associated with a doctor, such as diagnosis, prescribing, referrals and treatment management. What type of clinics do nurse practitioners work in the UK? A big area of employment for nurse practitioners is primary care. Nurse practitioners in primary care can work in general practice, walk-in centres, urgent care settings and out-of-hours services. I work in a general practice as a nurse practitioner, which is a nurse practitioner-led service. By this I mean this is a clinic where the nurse practitioners deliver the majority of clinical services, so they would be our first point of contact for the patients, with GPs working in supporting roles, providing specialist knowledge and expert advice to the nurse practitioners as and when needed. Other settings that nurse practitioners work in the UK also include secondary care. So, for example, in secondary care, nurse practitioners can provide specialist services, such as, for example, nurses working in stroke care, breast care, haematology services, and also providing acute care services such as intensive care outreach for retrieving sick patients from wards, and also providing emergency care in accident and emergency settings and minor injuries units. Whilst nurse practitioners are employed in a wide variety of clinical settings across the UK, there are some issues of concern related to practice for nurse practitioners in this country. These can be related to three different areas: the role recognition of nurse practitioners, prescribing, and the regulatory framework that exists for nurse practitioners. In regards to role recognition, this mainly concerns how the public and other clinical colleagues perceive nurse practitioners. Many members of the public aren't in fact aware of the nurse practitioner role and only assume that nurses can practice at their initial level of registration and that they are not able to provide advanced levels of care such as nurse practitioners do in the UK. This can sometimes cause problems for nurses working in nurse-led services because essentially they become the first point of contact for their patients, and if the patients are expecting to see a doctor, they can sometimes be unhappy with this fact. However, I have found from my own experience that this can be mitigated against by making sure you explain your service provision clearly to your patients, for example in the use of information leaflets, appropriate information on internet resources, and of course on face-to-face interactions, making sure that you explain very clearly that you're a nurse and the advanced role that you're working in. As regards clinical colleagues, opposition to nurse practitioners can come from a wide variety of colleagues. For example, our medical colleagues, allied health colleagues, and also our own nursing colleagues, who often misunderstand the nurse practitioner role and think that we're trying to emulate doctors or to replace doctors, or sometimes feel concerned about the levels of training that nurse practitioners have and don't realise that they're trained to a very high level, including a wide range of advanced clinical topics. This lack of role recognition in part arises from the fact that the title nurse practitioner is not regulated by the Nursing and Midwifery Council, and that any registered nurse without any further training can call themselves a nurse practitioner. However, this is likely to change in the near future, especially since the recent Prime Minister's Commission on Nursing has recommended that advanced nursing should be regulated in some format by the Nursing and Midwifery Council. And this would bring nurse practitioner practice in the UK in line with other countries such as the United States of America and Australia, where advanced practice has been regulated for a significant period of time. And this in turn would then allow nurses to have their role recognised by their colleagues and other members of the public. Finally, one of the most pressing issues of concern for nurse practitioners in the UK is that of nurse prescribing. Since May 2006, appropriately trained nurse prescribers, such as nurse practitioners, have been able to prescribe from the British National Formulary on nearly the same basis as our medical colleagues. However, most members of the public do not realise that nurse prescribers can also prescribe medicines on the same basis as doctors, and this can provide a challenge to nurse-led services, as they need to explain clearly that most of their practitioners can prescribe medicines for their patients without further reference to a doctor. Whilst in many instances this has speeded up access to care for patients, this can still cause some problems in relation to role recognition, as the members of the public do not realise that their nurses can prescribe medicines on the same basis as doctors. This relates to my previous point of the regulatory framework for nurse practitioners, and hopefully in the future in the UK, once advanced nursing does become regulated, members of the public will realise that nurse practitioners can also prescribe medicines on the same basis as doctors, and this will help to alleviate the tension that can sometimes exist between the public's perception of the nurse practitioner role and what we can actually achieve for them in practice.